Hello, everybody. Welcome to another episode of the We Care Health Talk. I am once again joined with Dr. Sant from the Wellness We Care Center. Hope you're doing well and had a nice holiday.
Thank you.
So we are back for another episode. Today we are looking at a different side of the health space. We're going to be focusing on mental health. So slightly different from the last episodes we talked about. We want to cover things such as stress management and other tools that people may find useful. And just to start with, maybe just to have a better understanding of how the brain works.
That is very broad question.
So hopefully we'll have a long discussion today. Starting point, I would say, yes, if we're looking at the mental side of health, where would you like to start? What do you think is the first thing people would want to know?
I think the first thing we should qualify the word stress first, because at times people come with stress-inducing disease, but they would usually say, I am not stressed, but why I have such and such symptom.
Right.
The meaning of stress, by medical definition, it is the body mechanism to alert itself in preparation for the danger from outside. So whenever it senses the danger from outside, automatically the body mechanism will click into stress mode, prepare. The main important point is that the so-called the danger from outside, or stressor, what we call stressor. Actually, it's not outside nowadays. It is inside. It's our own thought.
Right.
The content of our thought is automatically perceived as real. That content of the thought, it is perceived as real. And if the thought is kind of a negative thought, it will be perceived as the danger from outside.
Right.
So the point is that our own thoughts initiate the stress response.
So what happens to what's the main mechanisms that go through the body when we're feeling stressed? Or let's say we receive an outside or an internal signal?
The body is automatron.
This is an automatic function. You cannot control it.
A machine. The body is a machine.
Okay.
A robot.
The body is, yes.
That is the way the body is built. It has probably a million of electrical circuits. All of them work automatically. We call this reflex. For instance, if we touch our hand with hot stuff, we will suddenly track back. All of this occur automatically because the way the body works, it works as a robot. You don't have to think, you don't have to prepare. So stress response is 100% automatic.
Oh.
That's how it works. It is the wiring that occurred a long time ago, probably before we birth. I mean, from our ancestors.
We're talking about genetically.
In our gene, it's
hundreds of thousands of
why
years
the
ago.
circuit in there. And since born, we learn a lot, and that doing more the circuit. All these circuits dictate the way we respond to what we call stressor. And sometimes, or most of the time, we do not aware of the way this mechanism work. Man does not know that he is automatron. that's the problem. If he knows that he is an automatron, he will be able to cope it better.
Maybe better at handling the stress.
Yeah.
But it's like you said before, maybe there were real outside signals of danger, things like that we experience like every day in real life. So that's why we have this built into our machine body, right? Or our brain.
The mechanism is designed to protect the body from all kind of danger. But from clinical point of view, I would say 99% of stressor now is the patient's own thought.
Internal stress.
Sometimes it starts outside as a story outside. Suppose the war between.
You watch the news, and you see that the world is about to have.
And how you respond to that news.
It causes you stress.
Yeah, when we respond to stimuli, the first responsiveness is thinking.
Mm-hmm.
The second is doing. Mm-hmm. So respond by thinking is the initiation of the stress response. So overall, it is automatic, and it occurs without our awareness, and it actually caused by the way we respond to the stimuli from outside. If only we are aware of the way we respond to the stimuli, we can manage stress 100%.
So what was the benefit even in the past of having this stress response? What does it do to your body that benefits us in the short term? Not forget about long term where we don't think of stress. Is there any benefit to this stress response?
Oh yes, of course. It is the mechanism to protect the body from
This
environmental danger. That's the main benefit of it. And once the body signal the stressful stimuli, it will speed up the system of the body that help fight.
The fight or flight, this response.
Fight or flight, yeah. And it will prohibit the system that not important for the immediate situation. For instance, dietary system to eat and to digest is not important because
it will shut down your digestive system.
It will shut down. Yeah.
Oh.
Our reproductive system is not important. When we are stressful, the system will be shut down.
Okay.
But some system like blood coagulation is very important because in fight or flight we may lose blood.
Mm-hmm.
So the system will work more than usual. Our blood will clog up easily in a stressful situation. Our cardiovascular system will work more because we need strength, need power to do things.
Heart rate will go up, blood pressure will go up.
Yeah. We breathe faster.
More brain activity as well. Does anything
more
happen?
Alert.
Your brain becomes more
alert, but sometimes alert too much.
Too alert. Yeah. So
that because anxiety and cause unnecessary thought.
Mm-hmm. Right.
Mm-hmm. Mainly negative thought.
And this all is. So I've obviously heard of these terms. I just want to. So this is all due to one hormone, cortisol. Is that the main stress hormone they say in your body?
There are a few hormones that released in our bloodstream when we are in stressful situation. Cortisol, adrenaline, or epinephrine, for instance. Actually, there are something like 700 type of molecules that released into our bloodstream.
Mm-hmm.
We don't know much which one work in which way, but we know quite a lot about cortisol and adrenaline. then in dealing with stress problem, there's no point pay attention to what type of hormone we secrete. The point is how to be aware of our own thought.
Right, because like you said, it's mostly an automatic response anyway.
Yeah,
so
yeah.
we haven't come up with a way of measuring people's stress level. Is there a test you can do?
Yeah, in clinical practice, we have what we call a stress measurement questionnaire.
Oh, we do. It's a questionnaire based.
Questionnaire based, yeah, pretty accurate, but it is not the making diagnosis is not very important because the patient themselves they know.
Right.
And we can observe circumstantial evidence. We as a doctor, when we see patient, we can observe circumstantial evidence. Look at patient's face, the way they speak, the way they think. So we can decide nearly immediately that they are under stressful condition or not. But how to highlight the importance of being aware of his or her own thought. That is the main thing. And I said, aware of the thought. Not. There are two things that I want to make it clear here. To aware of a thought, we know what we are thinking. But to thinking a thought, that is the when we are thinking a thought, we don't know. We are not aware.
Yeah.
So thinking a thought bring us into more and more stressful condition. But to aware of a thought, we become the observer, and that thought will subside quickly. So to deal with stress, people got to learn to be aware of a thought.
Right. So that's what you're saying. It's not, you don't focus too much on like measuring or worrying about people's stress.
No.
It's about stress management is the key thing here, right?
To and when you said the word stress management, in the old day, our methodology, in medicine, we manage stress in engineering way. The cause of stress, the stressor is outside.
We try to reverse engineer it.
Yeah, we manage outside situation. If the stress situation occur because of the family environment, we organize family meeting.
Right.
You should do this, you should do that. You should not say that. You should say that. It doesn't work. It does not work. Because it's the way the patient responds to all those stimulation, the way the patient think. So we got to, when we say stress management, we got to focus on the way that patient responds to stimuli, the way that patient think, or to precisely, we've got to focus to teach the patient to aware of his or her own thought.
Right, because first it could be the family, then it could be work, then it can be, but the main thing is it's an internal response, right? So what are your, you have daily practices for this that you can share?
Me, myself?
Or what you prescribe to
because
your patients?
Before I treat patient, I got to treat myself.
Practice what you preach.
Yeah. To be aware of our own thoughts, the most important point is our attention. Because where is our attention? Our energy will be there. Usually, our attention is in our thought. So all of our energy will be in the thought. If it is positive thought, that will bring us more energy. If it is negative thoughts, it will bring us downward. The first thing is to retract attention from the thought. But the nature of attention, it needs something to pay attention to. So the easiest way is to retract the attention from the thought and focusing on something harmless like breathing, our own breathing.
Right.
For instance, the Buddha taught the breathing meditation. That is, retract our attention from the thought and pay attention to our breathing instead. Breathing in, we know we are breathing in. Breathing out, we know we are breathing out. That is the step one. But I have found that we need more than that. Just follow the breathing. We cannot follow it long. The second tools that I think very important is to learn to relax our muscle.
Mm-hmm.
Because the stress, it's just like do you have a pen? Yeah.
A pen.
Uh-huh.
Let
Then we have
we can get a pen.
Mm-hmm.
Yeah, we'll see if we can get one for you.
Thank you. Our thought, it's just like it is a thing with two sides.
Yeah.
On one side is the content of the thought. Thank you. Suppose this is our thought.
Yeah.
On one side is the content of the thought.
Mm-hmm.
On the other side is the contraction of our body muscles. Whenever the thought arises, our muscle will be contracted. It is natural, because it is the work of automatic nervous system. And when we act on one side, it will give the result to the other side also. Suppose we relax our muscles, the thought will melt away automatically.
The thoughts will disappear.
Yeah, will disappear. Or when we observe our thought to make the thought disappear, the muscle which previously contract will become relaxed automatically.
Right.
So what I practice myself and what I taught is that to teach people to relax the muscle as part of meditation, as part of their daily life routine. And the first muscle that I teach people to relax is their facial muscles.
The face.